What did Democrats achieve now that the government's reopened?
Well, at the very least, we raised the awareness that we're about to see a doubling of these premiums for 24 million Americans. Hopefully, people will be calling the White House and demanding that we fund that premium subsidy the same way we have for the last several years. And hopefully the president will get the message. Instead, what he's doing is he's throwing out, just to distract people, the idea, well, maybe you'll get the money and some of you'll get the health care too. If he had a particular proposal, that would be fine. But since he came down that escalator, he's been saying he's going to replace Obamacare with something much, much better, and he'll tell you next week what it is. And his objective is to destroy Obamacare and replace it with nothing.
Wow. Congressman, I appreciate your joining us and staying in town here. I know a lot of folks have already left. I'm just wondering if you think this was worth it. Did Democrats in the Senate cross over too early? Because we kept hearing that a promise of a vote was not enough, and it looks like there is no promise in the House.
The promise of a vote is illusory. Even if they were to vote it on the Senate, it probably wouldn't pass because Republicans would vote against it. Even if it passed the Senate, it would be shredded as soon as Mike Johnson, the House Speaker, got his hands on it. So that's an illusory promise. What we really need is to bring down the cost of the overall health care system. And that requires, I think, adopting Medicare for All. We've just got a crazy and complicated and very expensive system in this country. Medicare for All is the way to make it sane. Also, I'll be introducing a bill later this month or early next month to regulate all pharmaceutical prices the same way we regulate electric prices.
Well, I appreciate you bringing up some tangible policy solutions we could see to help lower costs for Americans when it comes to health care, because we've heard Republicans say that just extending the Affordable Care Act premium subsidies would be putting a subsidy on top of subsidies. That's often the talking point that we hear. But I'm wondering, do we need to see an extension first when it comes to these tax credits in order for there to be time down the road to negotiate on a fuller deal like you might be outlining here?
Look, President Trump, he keeps talking about abolishing Obamacare and replacing it with something even better, and he won't propose anything. Progressive Democrats have. We call it Medicare for All. But that's not a solution to the problem that we have in the next 6 weeks. Those premiums are going to double. We need those subsidies restored. And if millions of people will call the White House and say that, it'll happen.
Medicare for All. Congressman, you're bringing us back to 2008, 2009. If Barack Obama could not get that done, how do you do it with this Congress?
Well, we tried Obamacare. It's worked, I think, reasonably well. Republicans think it needs to be repealed and replaced. They don't have a proposal. We do. And I think that as more and more attention is paid to our health care system, we'll realize that we are by far not the healthiest of the rich countries in the world, but we pay usually about double for health care what other advanced countries do. A system of covering everyone makes sense and would be a lot less expensive.
Have you gotten any indications from Republicans that this is something that they would negotiate on? Have any talks been happening on Capitol Hill? I realize you've only been back for one day, but it is clear that this has been the issue that we've been teeing up for a conversation on this entire shutdown.
There are a few Republicans that want to restore the Obamacare subsidies, more in the Senate perhaps than in the House, but Republican leadership, I think, is going to try to do either nothing or do just a little bit so that they can say they did something. But they're hell-bent on even increasing the tax cuts for the very wealthy, and they know they can't do that without gutting programs like Obamacare.
I want to ask you about the discharge petition that we now understand will get a vote next week to release the Epstein files. We spoke yesterday with Ro Khanna and with Tim Burchett about their efforts here to get the files out. And I'm wondering if you're prepared for that vote? And if that's as far as we go, Congressman, it doesn't appear to have support in the Senate. The president would have to sign it, right? Is the Oversight Committee the best venue for these documents?
Well, the best venue is the floor of the House, and we will be voting on that next month. But it's going to take a lot of political pressure to get the Senate to vote on it. The reason for that is that in the House, you have a discharge petition process. So 218 members can sign, and a few Republicans joined us. In the Senate, it would take a lot of pressure on Thune because there is no discharge petition process. There's only popular will.
But is there any indication that that pressure is building, or is this going to be a futile exercise if ultimately these documents don't get released?
I think that this is the issue that will not die, and that eventually the public will demand the release of the files. You see the release of some of those files just this week. We're going to continue to have that, and ultimately the president is going to have to explain what his relationship with Epstein was and why he is so opposed to releasing the documents.
You know, you step back from all of this, Congressman, I just wonder how you're feeling today. We've been talking with Democrats and Republicans over the past 48 hours and, in fact, over this entire shutdown. And now that we've actually got the government back open, everybody seems to have some kind of a hangover, in a bad mood. There's a lot of concern about the health care debate coming, whether we shut down again in January, what the president's going to do next, where the leadership is on everything that we've been talking about. How would you describe this political moment that we're in?
This country is more divided than it's been since the 1860s, and hopefully there'll be more people who say, I know I want this or I want that, but what I really want is a compromise that gives the other side something as well. I haven't seen that from either side of the political spectrum, and all the polls are telling, and a lot of the problem is your phone, which is programmed to give you opinions that push you in the direction you're already in. And I wish I had a solution to that, but hopefully people are getting more of a reasonable and centrist view here on Bloomberg.
So throw your phone in the water, Tyler.
If only.
Oh, absolutely. Watch Bloomberg, throw away your phone. Yep.
Well, that's the political stakes, perhaps. I also wanted to pull on your expertise on the House Financial Services Committee and asked about the economic stakes here, because the NEC director, Kevin Hassett, today said that we may not get the unemployment rate for October. If hindsight's 20/20, we're talking about the stakes right now. Do you think in a different world we should have deemed data essential so that we could have accurate forecasts for the economy?
Absolutely. I think that what the Bureau of Labor Statistics does is essential. And I know it's been derided by this administration, but the fact is that you talk to people, they think there's inflation. The statisticians have shown us there's inflation. The only guy who doesn't see inflation is Donald Trump.